Jai Hind everyone, my name is Ankur. I'm your host from the Seafood Club, and today we have a guest with us. His name is Michail Chopra. He is co-founder, CEO of Mayfair We Care Limited. This is the first ever overseas guest that we had, and he's coming from the leadership background, wherein he's going to talk about HPA, which is also known as Health Benefit Administrator. Mayfair We Care is basically an international firm, which is also now in India, where they cater globally, not just the retailers, but also to the corporates as well. So, welcome to the show.
Thank you, Ankur. It's great to be here.
My pleasure. Michael, could you tell me about yourself and about what Mayfair We Care is all about?
Sure. So we're a health benefits administrator working in the international space when it comes to international private medical insurance and travel. We focus on delivering health benefits administration to insurers, corporates, globally. We were founded in 1992 by me and my father, actually as a consultancy business. We entered the insurance market as a broker, working with Indian large corporates, sending employees overseas. Actually, when we first started, it was mainly business to the US, as we found a lot of the large IT players from India sending a lot of employees to the US to work on technology solutions. When we looked out into the market at that stage, there were only 4 possible insurance solutions you could take while traveling to the US, and they were all through the PSUs. What we found was that there were certain gaps in the covers and benefits that the way they were structured. So we went to an international market called Lloyd's of London to see if we could build a better product to better serve our Indian brothers and sisters traveling overseas. That took us about a year to launch that product, insured by Lloyd's of London. We brought that to the Indian marketplace, and we were able to attract some very large corporates in the first few years to come and use our insurance products. At that stage, we weren't involved really in the service delivery, but rather the broking side of it. Over the years, as we worked within the insurance market, what we found is actually building a product and getting an insurer to underwrite the product is not necessarily the most difficult part of the journey. And we felt that what was missing was someone who understood the Indian culture and the Indians traveling overseas. So we decided to step into the administration space. And that was about 15, 16 years ago when we went into the administration space. And what we found as we started doing administration of health benefits for expatriates specifically, we found that actually that was our passion. Our passion was looking after our Indian brothers and sisters traveling overseas. So then we decided to build our own administration company, which is what Mayfair We Care now is. And we focused on the Indian market with employees traveling overseas. What we found was with our Indian brothers and sisters traveling overseas was, as we were going through that journey, we found that they enjoyed having that sort of human empathy from people administering their policies from India. We've always been Indian based. We've had an office in India now for over 25 years. And we've been able to build our presence here very strongly. And what we did a number of years ago, probably about 5 or 6 years ago, is when I met Dr. Vikram Chatwal. We were able to have a connection through a human connection, which is very important to us because I always speak about human empathy when we deliver our services to our members. Me and Dr. Vikram Chatwal had a great connection. We felt the two companies had great synergies. One of the things that I really felt was interesting from the MediAssist point of view was the technology that they were able to deploy in India to look after 180 million people across India. When I looked at that technology and I compared that tech to what we see overseas and in the global space, there just wasn't anything that could compete with it. So that was a big attraction for us to work with MediAssist. And then we joined the MediAssist family. We've been able to deliver that technology into an international space. But the one thing that we never forget is human empathy. I mean, you can imagine you could be an Indian expatriate in your 20s, first time you're traveling overseas, and you travel from Mumbai to Finland in December. For example, in Finland, you'd probably have about 4 to 5 hours of sunlight a day, 6-foot snow drifts, -6 average temperature. You don't understand the culture, you don't understand the food, you don't understand the language. So we leverage our technology to enable our members to have an easy journey when it comes to looking after their health benefits, never forgetting the human empathy and the connection that humans need, especially when they're not feeling well or if one of their families isn't feeling well. And that's sort of a quick synopsis of the journey of Mayfare We Care to date.
Amazing. I mean, I completely agree with you on this, because you definitely need to have a human empathy when it comes to medical, right? Because that's one of the most serious condition anyone can get in. Could be any accidental case, could be cardiovascular, anything. You have mentioned Indian brothers and sisters while you were talking to me, and how did that develop in you? I mean, your name has a surname which is a Chopra, of course.
Absolutely.
So do shed some light on that fact, and how is it that you really wanted to like help Indian brothers and sisters?
So what we found as we were doing the insurance broking and we were working with other health benefits administrators, or TPAs, as they're known in the market, we just felt there wasn't that real connection with the end user. And as you rightly said, when you're not feeling well, you're overseas, you don't understand the language, you don't understand the culture. Even worse, if you're traveling with your family and one of your family members gets sick, maybe it's your spouse, maybe it's your child. You have to have that human connection, right? I'm not feeling well. I don't want to just use tech to tell someone I'm not feeling well. Can I go here? Can I do this? So we have teams based in India, obviously Indians. We run a call center within our claims team and within our assist teams. So when you want to reach out to someone to have that sort of human empathy, or you can even arrange calls through our Mayfair app, and we will call you, because I think it's important to really understand what the need is. And sometimes that can be lost if you're just sending a message or you're just using technology. So we always have that capability for our members to reach out to us 24/7, 365 days a year. So one of the interesting innovations that we actually brought to the Indian marketplace was when we were an insurance broker working with Lloyd's of London. We realized that having human empathy is important, as I've spoken a lot about it. How could we help our members when they were having a maternity claim or they were pregnant and they were going to give birth? So when we looked at this, we felt the best thing to do was allow the mother to travel back to her home country, mostly India. You understand the culture, you're in familiar surroundings, you've got your family to support you there. And also from an underwriting and insurance perspective, it's much cheaper to pay for a maternity claim in India compared to the US or other certain countries. So we built a product that would allow the mother to travel back to India, have the maternity claim here, and then travel back to the on-site location with the baby. And the flights would be covered, including the actual maternity, prenatal, birth, and postnatal. And that was a big success for us. I think from a human empathy perspective, that was very important. And that's something that we're very proud of. And that was something that no one else at that stage was doing. And then we found that other insurers were sort of bringing those kind of products to the market as well, which was quite interesting.
Mike, you had mentioned a lot about human empathy and technology. And when you say technology, what application or what technology you're referring over here?
So our platform is called Health Accelerator.
Okay.
It's something we're very proud of. It allows our administrative teams to interact with our members, but also allows them to process and automate some of the claims processing angles. We're looking at including AI fraud detection, which we've had some of in our systems, but we're looking to expand the utilization of that. So there's a lot of technology that we're starting to bring to the international market, which is currently not available, but it's something that really differentiates us. And our Health Accelerator platform is also interconnected with other platforms that we work with through APIs. So our foreign exchange payments partner is integrated to our system. So through the app, when you're trying to make a reimbursement claim, it actually allows you and guides you and tells you what information it needs. If you don't have the right information for that particular country, it will stop you from going further. What that allows us to do is reduce the number of incorrect payments and bounce backs, which is better for the insurers, but it's also better for the end user because they're more likely to get their money the first time than have to keep following up. There's a lot of innovation coming, and honestly, that's mainly driven through the technology we see being developed and deployed in India.
So, Mike, been a great insight so far. You've been in the industry for over 25 plus years and the great intelligence which you've provided. Apart from India, where else are you located geographically?
Okay, so Mayfair We Care is a global company, and we currently have offices in the UK, India, Australia, Singapore, Philippines, and the US. And we're looking to expand further in due course.
All right. So now that you mentioned about these countries, they all operate in the same space. Who are they catering to?
Okay, so we mainly can cater to Indian expatriates traveling overseas, but we also do look after a large international pool of employees that work in various industries. We do a lot in the marine space, looking after seafarers. We're one of the largest TPAs when it comes to looking after seafarers in the marine space. And we also look after other large MNCs that are not India based but have offices overseas. And that's really our sort of core business. And we've recently entered the retail travel business as well, and personal accident. So that's, again, those markets are really, the travel is driven, I would say, by a large number of Indian insurers. And then I would say the personal accident market is more driven by Lloyd's of London, where we work very closely.
You mentioned you have call centers in India, basically catering the Indian expats. How are you catering the other people from different nationalities, different language speakers?
Well, with the technology that we're able to deliver, languages these days aren't as much of a problem as they used to be. So we use technology to help us with languages. We have the ability to communicate with our members in over 100 languages globally. And that really does cater to most of the market. But I think you touched on a point there. We're quite lucky that English happens to be the globally dominant language. So most of our communications, our documentation, when we speak, is in English, but we do have the capability to have 100 plus languages.
What all other capabilities, apart from helping out people from different languages, what all other capabilities does Mayfare We Care have?
Look, one of the things we've been speaking a lot about is how we look after our members. But actually, just as important is actually who our clients are. Our clients are the insurers. So what are the services we can deliver to them on their behalf to their members? So we have many tools through our office in the US. We're able to achieve substantial savings on repricing of claims costs in the US. Through our technology, we're able to deliver parametric solutions when it comes to flight delay and baggage delay, which is something quite new to the market. We're able to access EAP services. We're able to access globally virtual GPs and doctors, including pharmaceutical delivery to your location, which is quite unique for a global health benefits administrator. And there's many other things that we focus on. One of the things that we're quite passionate about is we work with the World Health Organization. So with them, we run a calendar we speak about 2 topics that they pick every month, and we deliver that through our platform, through our technology platform. And it's not just a recorded sort of scripted play. It's really having a consultant who's a specialist in that area, speaking to our members, speaking to our audience, and them having the ability to ask questions. So one of the things that we're very particular about is helping educate our members about health and about what the services we provide. But for me, it's even more important that we focus on their health, because the insurance industry as a whole has become very reactive. I actually believe the insurance industry has to become more proactive. Why are we letting people have those chronic conditions, diabetes, heart conditions? Why aren't we focusing on keeping them healthy so they don't have those problems later on in life? And that's something why we do a lot of this outreach to our members. We give them access we run a health newsletter every month. It's 3 or 4 pages long that picks a topic that we want to speak about. And that's actually based off the information we see from our claims technology, because that can point to certain conditions or certain issues that our members are having. So therefore, what we do is we build newsletters to try and address those. We try and do as much as we can to help our members.
I have a question here for the viewers. You had mentioned EAP service. What is EAP?
Employee assistance programs.
All right.
And this is sort of programs where if you're having mental health issues, you can reach out to a number, or you can through technology to a counselor or something like that. And they would then be able to sort of, maybe alleviate some of the anxieties that you're facing. And those are important services to have as a health benefits administrator.
You've been operating in a lot of geographies altogether. Can you draw a parallel difference between the Indian market and different geographies in the world?
It's a little bit difficult to just do India compared to the rest of the world, because certain geographies outside of India do have quite advanced health systems compared to what's available in India. But what I can generally say is, one, the penetration in India is very low, and that really does have to change. What I am happy to see is now more policies coming out with outpatient care, which never used to be there. It was always just about inpatient. So that's good. If you look at somewhere like the US or the UK markets, for example, outpatient is fully covered, dental, vision, prescriptions. So I think India's moving in the right direction, but the only concern I have is the low penetration. And I would say even more so specifically in the rural areas. So I think that's something that India has to work on. I think people are now, especially after COVID and the issues that arose there, people are seeing more benefit to having a health insurance policy. I mean, I've been coming to India since I was a little kid, but when I started coming here for work, I'm now 51, so 25 years ago, wasn't many gyms around. Even in the hotels, 5-star hotels, no, not many gyms. Now you see massive gym chains. I stay in Koramangala. There's a lovely park just across where I stay. I go for a run, and every time I now go for a run, it seems to get fuller and fuller and fuller. So it seems like the health is becoming more and more important, which it always should be, because honestly speaking, if you don't have your health, you have nothing. It doesn't matter how much money you have.
Health is the greatest wealth in the world.
Absolutely. Well said.
In this conversation, and we've understood, and viewers have also understood about your network capabilities altogether, globally and in India. What are the 3 key takeaways that you would want people to understand and to know about from this podcast?
Well, for me, Ankur, the most important things when I look at them from my perspective is, 1, how can we leverage technology to make people's lives easier? 2, never forgetting human empathy. The last point, the third point, I would say, is delivering the best possible results for insurers, because at the end of the day, they are our clients. Yes, the end member is the most important for us, but delivering good results for insurers, giving them access to live, allowing insurers to make intelligent underwriting decisions is also very important because that can stabilize their premium, which is what the end user is actually paying for the service. So those, I would say those are the three most important things for us as a business.
Right. And how do you envision Mayfair We Care
Going
moving
forward?
Yeah.
For me, Mayfair We Care going forward, I would like to see having at least 1 million members globally, expanding our global footprint when it comes to members. And we're in discussions with some very large insurers, global insurers, life insurers, PA insurers outside of India that we're looking to work with going forward. And what I'd like to really do is duplicate what we do, say, in India, in other countries. So we do have a large cohort of Europeans that we look after. We have a large cohort of Americans and Filipinos that we look after. So we are starting to grow that footprint, and I'd just like to accelerate that. So as I was just talking about the future, also I have some exciting news to tell you about, Ankur. So we've recently entered the US market. We've opened up an office in Florida. Specifically, we're looking at our ability to reduce claims costs and repricing and network access in the US market. But actually, what we're also doing is we're servicing quite a large number of seafarers from the US market. So that's why we've specifically picked Fort Lauderdale in Florida, because that is a seafarer hub, specifically for the cruise line business and luxury yacht business. And that's something that we're very strong in other countries. So we're trying to now ramp that up in the US market as well.
Well, congratulations on opening the office in Florida. I would love to speak with somebody from your US office and probably take this conversation even further and ask to understand how you are catering the US market when it comes to HPA and delivering services.
And Ankur, thank you very much, firstly. And I'd love to introduce you to our head in the US. She's a lady who's got 30 years of experience in working in the US market and the Canadian market and LATAM. So I'd be more than happy to make that arrangement for you.
Question from you. You had mentioned this lady here who has an experience of 30 years, and off the record while we were speaking, you had mentioned that you have employees in your company who've been associated with you for over 25 years now. So you've spoken about the members and membership. I've understood how human empathy works and how you envision your company as well. What I would really like to understand you is, how does your internal stakeholders, your employee culture, your company as a whole, how do they function, and what sort of culture you have in the company? I'm sure it's great. I mean, people are there for almost 25 years, but I really would like you to shed some light on it.
Sure. Firstly, thank you for that question, because actually everything else we've spoken about is not possible without the people that I work with. And I hate referring to myself as the CEO or the boss. I'm not. I'm just one of the family members that deliver the services to our members. And so it's very important for me that my employees feel like they're part of the team, part of the family. And whenever I refer to the people that I work with, it's always part of my extended family, the Mayfair family, as I like to say. Because really, without them, there isn't a business. And the way I try and treat everyone, this is in my personal life, my work life, is the way I would like to be treated. So, and I think this is something that is important for everyone. Everyone should treat others as they would like to be treated, because I just think that would make the world a better place for all of us.
Well, truly said. Thank you so much for being on this podcast with me, Michael. I really appreciate you taking out your time and having this conversation with me. I'm pretty sure people out there in the world will probably take those three key takeaways that you had mentioned. And all the best for your future endeavors.
Thank you, Ankur, and it's been an absolute pleasure.